good morning to all of you. Today, we have a very special guest speaker with us, Honorable Birungi ma'am from Uganda, East Africa. She is a neuropsychotherapist, researcher, lecturer, counselor, and spiritual mentor, and doing a great work in the field of humanity from many decades. So it is our pleasure to having ma'am with us. And today is very important and interesting topic she is going to discuss. That is the addiction as a disease of brain and attachment. So, not taking too much time, I would like to invite our honorable guest, ma'am, kindly proceed today's session. And if anyone has any query or question, they can ask in the comment box directly. Thank you so much, ma'am, once again for providing your time.
Thank you, Samyak, and I greet everybody who is with us on this broadcast. So today we are going to be looking at the types of addictive behavior, the brain cycles of addiction. We are also going to be looking at the brain center of attachment. We look at what sets the flow for addiction and the part of the brain that is affected by addiction. Then we'll go into the signs, symptoms, and effects. And then we come to codependency traits and the roles adopted in a family because of an addiction. And lastly, we'll look at neuroplasticity and holistic therapies of addiction. So we are looking right now at a biologically driven process. Addiction is more about neurology of the brain than the outward behavioral manifestation issues. We used to think it was driven by failure of morals or willpower. While people's choices are strongly involved, we now know it has physiological, neurobiological components as well. Negative consequences don't affect an addictive brain the same way they do to a normal brain, because the rational mind, when we are in addiction, it is hijacked by the addictive personality. Alcohol and psychoactive drugs addiction, we are now looking at the addiction types and the compulsive behaviors. First of all, we can be addicted to alcohol and psychoactive drugs. We can be addicted to gambling, shopping, or exercise addiction. We can also be addicted to using computers, cell phones, and internet gaming. We can also be addicted to pornography, to food, to work, and we can be addicted to love, obsessiveness, and stalking a partner, and we can also be addicted to sex. We can also be addicted to spiritual obsession. This will not be confused with devotion. And we can be addicted to seeking pain, like cutting ourselves. We can also be addicted to shoplifting or kleptomania. And we can be addicted to persons, places, and things. Most of us are addicted to orderliness, perfectionism, the ritualistic way of doing things, obsessions with a place, a possession, or a relationship. Now, next, we are looking at what actually addiction is. Addiction is a highly complex, progressive, chronic, relapsing disease of the brain and attachment. Those uncontrollable compulsive actions that are controlled by the brain's pleasure pathway when the brain is hijacked by that pleasure pathway. And this affects our thoughts, it affects our behavior, it affects our mind and spirit, and it takes a toll on the body, especially it affects the liver if we are taking alcohol. It gets one in conflict with the law, and it causes issues at the workplace and livelihood, and it can affect family relationships as it digs into the finances and the pockets. Now, let us look at the brain cycles of addiction. When we look at addiction being progressive, chronic, and relapsing, it's a three-stage recurring cycle. First and foremost, we have that binge intoxication. This is where we are at the progressive stage, where we are using or abusing, and this leads to tolerance. Then the next cycle is the withdrawal, where we have negative effects, and this is the chronic or dependency. Then the third stage is where we have preoccupation and where craving comes in and where we are susceptible to relapsing. And this worsens over time and actually attachment. And attachment happens in the brain. Attachments are in the limbic system, which is responsible for bonding and attachment. The limbic system is somewhere in the midbrain. Now, as human beings, we are social beings. And we crave attachment right from the time we are born, right to the time we go to the grave. And this attachment is a sense of self, a sense of identity, and a sense of belonging. And it develops through internal, interpersonal attachment. We are born in group, we develop in group, and mostly we die in group. When a person dies in a village in Africa because of the we collective way of being, the whole village is at a loss. So this kind of bonding is fragile when we don't feel emotionally secure. So addiction is a distraction of the sense of that cohesive sense of self. So we get attached to the drug as a substitute when we have missed that attachment right in our childhood. We continue to look at addiction as a disease of attachment. So we get from attachment to humans and we get to attachment to a substance or a behavior. So addiction is a form of attachment to drugs or alcohol, and it has its roots in the absence of secure attachments in infancy. We need attachment our whole life as social beings. We thrive when we have regular, healthy attachments. That need to belong, that need to bond, that need to feel safe, and that need to have an identity. So we will feel low when we're abandoned or deprived in some way. And this can happen with changes in the primary caretakers leads us to have that sense of feeling insecure or neglected or not belonging. And as humans, we are wired to seek pleasure when we feel low. We look for an activity or something that will make us feel good again. Now, this parent-child attachment issue, the need to belong, abandonment, neglect, whether physical or emotional, these are the pathways to addiction and they are the risk factors. When we have unresolved trauma and abuse, for example, physical abuse, emotional abuse, or sexual abuse, when we feel like we are lost, we don't belong to the family that we are in, and we call it lost blood or kinship. when you feel you don't belong biologically to that family that you are in. For example, children who are born and they feel they don't belong to a family, or if a woman comes with her child, or a husband comes with a child not belonging to the current wife. Other risk factors involve parental separation or divorce or household violence. Substance abuse, mental illness, and incarceration could also be risk factors. So anything that sets the floor for addiction. When a person looks for something to make them feel better, there seems to be something missing. They don't like the way they are feeling, so they seek out a mood-changing experience in order to feel different, in order to get them out of their low position. So when the mood is low and there is imbalance, it is so highlighted that the brain wants to experience it again and again and again and again. And before we know it, all the brain cells are drenched in this particular substance, and the brain cells undergo structure change in order to get used to this incoming dopamine of the initial first high. Unfortunately, in the first cycle, where we have a person taking a drink, where it is progressive, here a person gets that initial high that is so salient and so highlighted, and they want to seek it over and over again. A person takes a drink. This is the progressive stage. This person seeks the initial high, and it is so salient and so highlighted that they want to seek it over and over again. And because of that, over time, the brain gets used to the dopamine that is coming in to give that pleasure, and the structure changes will take place in order for them to want to keep on using it again and again and again. So this leads to the second stage, where the drink takes the drink, because at this stage that structural change has already happened. Now this new structure change only looks out for the alcohol. So in actual fact, it is the drink now that is taking the drink, because the brain cells have become the drink themselves. And when a person is taking the drink, it is actually the drink that is taking the drink, because of the structure change that has happened within the brain. Now, withdrawal symptoms are going to come in when the person stops taking the alcohol or the behavior. Now, in the third stage, will have altered the brain's reward system, and there is loss of control. And now the person will no longer be in control. The addictive personality has already taken control. Now we look at the next slide, where we are looking at the parts of the brain that are responsible for this kind of scenario. You'll forgive me, the terms are too scientific, but all we need to know is that there are two pathways. The first pathway we are looking at two main pathways. The emotional pathway, where the person learns to feel that high when they are having that pleasure. And then the other one is the cognitive learning pathway, where the person learns that they have to keep on doing that behavior because it feels so good within them. Now, when we look at the parts of the brain that are responsible for addiction, those are the two main parts, the emotional brain and the cognitive learning brain. Now let us look at the cause of addiction. The etiology of addiction, once and foremost, it is family history of addiction, and it is influenced by genetics. There is also an environmental component. There is that inability to consistently abstain. Listen to this very well, and if you are reading it on the slide, pay attention to it and see if it applies to any member of your family. First and foremost, there is inability to consistently abstain. There is impairment in behavior control. There is craving. There is diminished recognition. There is dysfunctional emotional response. There is resistance to change despite increased problems. And there is lack of readiness to get help despite admitting a problem. That's why we cannot diagnose a person who is addicted until they see it for themselves. Because actually, when we are addicted, we lack insight into our problems. Now, let's look at the signs and symptoms of addiction. There are changes in mood, appetite, and sleep, increased anxiety, dysphoria, and emotional pain, continuing use of the drug despite the negative consequences, engaging in risky behaviors, getting problems with the legal and financial issues, feeling preoccupied with the substance or behavior, losing interest in every other thing except the bottle or the game, putting the substance used or the alcohol ahead of family, ahead of work, ahead of responsibilities, using the substance increasingly in larger amounts and taking more of the substance than is intended, and then the inability to stop, and that's when withdrawal symptoms come in. Now, let us go to the effects of addiction on the brain. The effects of addiction on the brain. There is an impact on the chemical throughout the nervous system. There is intense stimulation of the brain's reward system. And this leads to euphoric feelings and strange behavior traits. There is loss of control of impulses as we continue taking the drugs to support the feel-good emotions. And this creates the cycle of drug use and intense highs. Eventually, we take the drug and we think it feels normal and it becomes normal for us. And when somebody says, you are an addict, the addict can easily say, it's you who has the problem, not me, because the addict sees it as normal. So this alters brain function, and there is rapid heartbeat, there is paranoia, there could be hallucinations, and it could lead to psychosis and eventually lead to brain damage and can even result in death. The effects of addiction continue now. The addict feels isolated and detached. They build behavior patterns focused around substance use. They may withdraw from normal social encounters and become alienated from family and friends. They may have friends they can attach to as long as they use the bottle or the same substance. The addictive behavior is very maladaptive. It causes problems not only for the individual, but for those around them, and especially for the family. And situations that seem more stressful than they really are seen with a different sort of lens because they magnify everything, they overthink everything, and they have difficulty identifying and expressing feelings. And eventually, because the family members are very much connected to these people that are in this habit, the family members end up thinking about the person who is addicted and their behavior than the person themselves. And this leads us to codependency. Now, what is codependency? On the next slide, codependency is a condition where a person becomes the caretaker of an addict. Codependents can be the spouse, the child, the parent, sibling, or friend. And codependency is the learned behavior. It is a psychosocial condition. It is an illness. It is also an addiction. Because people who are taking care of the addicts become addicted themselves to taking care of the addict. So individuals suffer more than the person who is addicted because they focus more on the behavior of the addict than the addict himself. They become so preoccupied with the need of the addict. So codependents end up suffering more than the person who is addicted themselves. As we continue codependence on the next slide, these codependents are not dependent on the drug itself, but they are dependent on the behavior of the addict. And this can sometimes be described as an addiction to another person. And it's unfortunate most of us are codependents in our families, especially where families are dysfunctional. We find ourselves wanting to control the behavior of the other person. And in so doing, we become caretakers. We carry the cross of the other person instead of taking care of ourselves. So we'll look together at the codependency characteristics. Let's get to that slide. And look at it very well, because all of us are codependent. Look at where you fall. As codependents, we have extreme need for approval and recognition. We tend to be hurt when people don't recognize our efforts. We have an exaggerated sense of responsibility for others' actions. We have a tendency to do more than our share all of the time. We confuse love and pity and tend to love people we pity in order to feel that we can rescue them. We have unhealthy relationship dependency so that we don't feel abandoned. We have a compelling need to control others. We lack trust in others and we lack trust in ourselves. And we feel that sense of guilt when asserting ourselves. And most times we are dishonest. And we might be poor communicators. We have difficulty in deciding and identifying feelings. And we might also have problems with intimacy, problems with keeping boundaries, problems with chronic anger, and problems with rigidity. These are the characteristics of codependency, and most of us are codependent. Now, when we go to the next slide, we are going to look at the family and the roles that children in that family of people who take alcohol or drugs, the roles they play in order to remain normal. We have the hero, and the hero presents magnified a happy family to the public, pretends everything is okay when it is actually not. Then the rescuer saves the addict from unpleasant situations. He might be the one to quickly take away the addict and clean him up when he has soiled his pants. Then there is this enabler who enables the addict to continue that self-destructing behavior. And it could be a wife who's always making sure the husband has money in his pocket to go and drink or to go and use the drug. Then we have this mascot. This is a child. When parents begin arguing over the alcohol, this is the child who will bring in funny situations in order to take away the attention. Then there is this lost child. This lost child suffers the consequences of the parent's addiction. Then there is this scapegoat who ends up being blamed for everything that is taking place in the family. Then there is the caretaker who takes care of the household addict's financial duties and takes over the role of the addict. And this can happen when this caretaker is the child, and the child ends up having the role of the parent before they are ready to be adults themselves. And this has very adverse effects to this child. Now, we will go directly to the brain as we get into healing. There is good news after this. Our brain can adapt quickly and surely because of neuroplastic changes, where the brain is taught to continue to use the drug or to stop using the drug. Luckily, just as addiction is learned, it can be unlearned. Neuroplasticity plays an equally important role in addiction recovery. Let us look at the brain's neuroplasticity. Just in the same way as addiction is learned, because the brain undergoes structural changes, it can also be unlearned as the brain is taught to rewire and to become new again. Because the brain has the ability to heal when it is prompted by the right external stimuli. So things like healthy behaviors, healthy thoughts and positive emotions, new abilities and new skills. These will help to form new neurocircuitry, new pathways, and new synaptic connections that can help the brain to rewire itself and find new pathways to bypass the broken connections. And it takes 14 months to restructure the dopamine receptors with treatment and with rehabilitation. So what is the treatment of addiction? Let us look at the treatment of addiction. First and foremost, we have motivational interviewing. As we are looking at the slide of treatment of addiction, motivational interviewing, it helps the addict to have insight into their problem. As we continue with treatment of addiction, psychoeducation helps the addict to get to know about their condition. Then we also have spiritual programs like the 12-step Alcoholics or Sex Anonymous. Then we have setting schedules in order to avoid the idle mind. We also have to address self-esteem issues. Cognitive behavior therapy can be used to change from negative to positive behaviors. We have to build and rebuild healthy social networks. It is beneficial for repairing structure, insecure attachment, and they need skills to help develop and maintain healthy, rewarding relationships. There will be need for hospitalization for detox, medication, and rehabilitation. Now, let us get to the holistic approach therapy. Holistic approach therapies involve non-medical treatments and recovery methods. Holistic approach therapies are used to complement traditional treatment practices, and they aim to bring the mind, body, and spirit into alignment. Holistic therapies treat physical, mental addiction symptoms, as well as emotional and nutritional imbalances. Holistic approach therapies focus on the overall well-being while also treating physical symptoms of addiction and withdrawal. And they do this through healthy lifestyle changes, through exercise, through meditation, through nutrition to overcome the addiction. So what do these holistic therapies include? They may include yoga, they may include Tai Chi, they may include guided meditation, acupuncture, massage therapy, spiritual therapy, counseling, proper nutrition, and art therapy. Holistic therapies may also include strengthening resistance to cravings, identifying underlying causes of addiction, reducing the appeal of drug and alcohol use, and prompting physical fitness and increasing self-confidence. Remember, there are those self-esteem issues because of lack of secure attachment that will need to be addressed. Now, as we continue to the next slide on holistic therapies, proper nutrition provides tangible healing. Body massage helps to release stress and relax the body. Meditative practice helps increase focus and clarity of mind. Exercise helps build routine, relieve stress, and strengthen the body. Acupuncture restores balanced body after extended abuse. And it helps recovering the patient's lack of sleep, poor diet, and emotional stress. Medically assisted detox and comprehensive medical care are also used in order to help a person heal holistically. Now, we have come to the end of this presentation. Feel free to ask your questions and let's listen to how this has touched you, especially. Okay. The first step is to admit that we have a problem. The second step is to find something higher than ourselves that can get us out of that hole that we have been put into. Then the third is to be able to put our mind to action. Because when we have an idle mind, we will always be lulled into taking the substance. So that's where scheduling comes in. You have to have a schedule, and the person who is helping you in the rehabilitation center will help you to build a schedule for you where various activities will be included so that you have something you are doing 12 hours round the clock. Exercise, yoga, good feeding, journaling, meditation, all the things that need to be done in order to rebuild your brain. And instead of using alcohol or the drug, you look for something you can take that can help you to reduce those cravings. Something sweet like a candy or taking coffee, milk coffee. I hope you've been answered.
Yes,
And
ma'am.
another thing you need to do is to look for another group of friends that can actually help you to take away that need for craving. Because if you stay in the same company that you used to use with, then the triggers for relapsing will be much, much more. Thank you.
Yes, ma'am. So, ma'am, here's
Yeah.
my personal question. So, ma'am, if someone is suffering, having addiction of alcohol or maybe drugs, not only he is the one who suffer, but also the one who surrounds and like family and friends. So,
Yeah.
like how family, play a role to avoid such kind of disturbance which caused by the addictions by the person, like fights and all. So, like as a family member, what one can do to help the addicted to avoid addiction?
As family members, remember, we are codependent. We are always looking at the behavior of the person who is using the drug or the alcohol. We also are helped in counseling sessions in order to be able to get out of our own codependency. Because the more we want to control the addict, the more the addict will keep on using. The more we want to control the addict, the more the addict will seek solace in the bottle or the drug. So, what we need to do as significant others, as family members, we need to take care of this person without them feeling that we are overly controlling them. Because the more we want to control them, the more we will send them deeper into the bottle. We need to do it mostly by appreciating them wherever they show even the smallest behavior of wanting to change. If he, for the very first time, indicates that he has a problem, this is the moment that we need to come in and show appreciation. This will help him so much to be able to have his self-esteem go up, because most people get into their addiction because of two things. They have nothing to look forward to, and two, they don't feel that sense of achievement. So by appreciating them, they get to feel that sense of achievement. By showing that we are taking care of them without over controlling them, we are giving them something to look forward to, especially when we build a routine around their activities where they feel involved in the activities of the family. Because most addicts feel like they have been outcasted. They feel they no longer belong to the family. They feel the family looks at them as the black sheep. So we need to keep them included within our activities, and we have to find a way of avoiding emotionally abusing them, because that makes matters worse. I hope
Yes,
this
ma'am.
has answered your question.
Yes, ma'am. Very well. Um, Ma'am, society plays an important role to get our like to control to avoid addiction. Like the mostly youth are the one who are affected by this certain type of addiction, like drugs, alcohol. So, like as a part of society, what society play a role to avoid such kind of bad incidents like addictions.
Thank you so much. First and foremost, we cannot say that a teenager is addicted until they pass that stage, because most times teenagers get to using and misusing because of peer pressure, because of the stage they are at. What we need to do as society is to put in place structures that will enable these youths or these adolescents to find alternative activities that will occupy their mind instead of seeking out pleasure because of social pleasure, social pressure. So what can be done, for example? Look around in your communities and see what the community has been doing to assist these teenagers. Most of the activities that are done for the teenagers are the activities that get them into the using of the alcohol in the first place. Recreational areas, they are used for social media, for cinemas, for videos, for, you know what these areas are used for.
Yes, ma'am.
What if instead we planned a holistic way of guiding these teenagers through motivational skills to make them the people they are meant to be in future? Something like career guidance, something like spiritual guidance, something like moral guidance that will get them to build those values and those virtues that they need to grow into morally upright individuals. What can be done differently in your own society where you are right now? Yeah,
And it is a great pleasure that you take this session, and it's really helped humanity as well as the one who are suffering from addictions. It is really helpful because you provide such a knowledge regarding addictions and how it spreads, and how as a society, as a family member, how can we prevent such kind of bad habit or addiction. Thank you so much, ma'am. I
thank you.